Hi, I'm Robin Tudor, founder of Empower Total Health, and the topic of today's weekly update is proton pump inhibitors, acid-suppressing drugs. Now, the chances are pretty high that right now you or someone that you know is taking an acid-suppressing drug. Over 20.5 million prescriptions for proton pump inhibitors, or PPIs, drugs such as Nexium, Somac, Prevacid, and Prilosec, were filled in Australia, a country with not much more than 20 million people, in 2014, with esomeprazole, or the generic name for Nexium, alone ranking as the 10th most often prescribed drug in Australia in 2015. Health authorities acknowledge that many people are taking PPIs without a clear indication for their use, a fact that I can confirm. Often when I ask my clients who are taking PPIs but don't have gastroesophageal reflux or erosive esophagitis or peptic ulcer disease, which are the primary prescribing indications for PPIs, when I ask them, so why are you taking this drug? I'm usually told something like, oh, my doctor told me it might help with my stomach problems. Given the mounting evidence of the dangers of PPIs, this irrational prescribing is incredibly irresponsible. Here are some of the health problems that PPIs have been linked to. A range of gastrointestinal symptoms, including bloating. In fact, 43% of patients who are prescribed a PPI develop bloating for the first time after 8 weeks on the drug. Irritable bowel syndrome. 20% of PPI users developed IBS after 6 months taking the drug. And small intestinal bacterial overgrowth, or SIBO, occurs in 50% of PPI users. There's also 74% higher odds of developing Clostridium difficile infection. This is a really severe infection that causes shocking diarrhea. And if you use PPIs, there's a 151% higher odds of suffering recurrent C. diff infection, so getting an infection again and again. There's a 45% higher risk of developing chronic kidney disease, and a 152% higher risk of acute kidney injury, and a 200% higher risk of acute interstitial nephritis in patients aged 66 and over. And there's a 40% higher odds of developing pneumonia and significantly increased risk of bone fractures. And there doesn't seem to be any difference between using the drug for the relatively short term, less than a year, or long-term use in terms of fracture risk. This includes a 26% higher risk of hip fracture, a 58% higher risk of spinal fracture, and a 33% higher risk of fracture at any site. In long-term users of PPIs, we see an 83% higher risk of developing vitamin B12 deficiency, which, if it's left too long before being picked up and treated, can lead to irreversible damage to the brain and nervous system. Now, here's something shocking. In all the years that I've been seeing people who've been prescribed PPIs, not a single one of them has ever had their B12 status monitored until they come and see me. Now, this vitamin B12 deficiency risk may help to explain a 44% higher risk of developing dementia in PPI users, which was identified in a German study of people aged over 75, since vitamin B12 deficiency can actually cause a syndrome like dementia. Now, as if all of that wasn't bad enough, PPIs have now been linked to a heightened risk of pretty much the ultimate adverse drug reaction, death. A study published in the journal BMJ Open in March 2017 tracked millions of US veterans, war veterans that is, using the Department of Veterans Affairs databases for a median time period of almost 6 years. The researchers found that people taking PPIs had a 23% higher risk of dying than those who weren't taking acid-suppressing drugs at all, and a 15% higher risk of dying than people who weren't taking a PPI. Now, the comparison group in this case was people not taking any acid-suppressing drugs, but also people taking an older class of acid-blocking drug known as H2 antagonists or H2 blockers. Drugs like cimetidine, soldis-tagamet, or ranitidine, sold as Zantac. And these were the drugs that used to be prescribed for gastroesophageal reflux disease until the PPIs were developed. So in other words, H2 blockers are less dangerous than PPIs, but it's actually better to be taking no acid-suppressing medication at all, at least if you would like to live a long life. Now, furthermore, in this recently published study, the longer people took a PPI, the higher was their risk of death. Now, this is called a dose-response relationship, and it increases the probability that there is actually a causal link between taking a PPI and dying sooner, rather than the association being due to confounding factors or just random chance. And if you take a look here at what's called the hazard ratio, you can see the longer that you spend on a PPI, and this is cumulative duration. So this includes going on it and off it and on it and off it again. The more days that you spend taking a PPI, the higher your risk of death. How do PPIs increase the risk of death? Well, the study's authors acknowledge that no one really knows at present, but they do point out that there have been test tube studies that show that PPIs increase oxidative stress, a kind of cellular rusting. They cause endothelial dysfunction, which means that the cells lining the blood vessels become unable to carry out their normal functions, things like regulating blood pressure and the buildup of atherosclerotic plaque. PPIs in the test tube once again shorten telomeres. This is the protective cap at the end of chromosomes that gets shorter every time a cell divides, and when it gets too short, then the cell can't divide at all, and essentially that's senescence. So the loss of a cell's power to divide and grow and carry out its normal functions, otherwise known as senescence, it has also been shown to be a consequence of PPIs, at least in test tubes. Now, a word of warning. Withdrawing from PPIs can be tricky. Some patients experience a rebound acid hypersecretion when they stop taking the drug. So in other words, their acid secretion gets higher than it was before they even started on the drug. And this can lead patients to conclude that they can't stop taking it. It often leads their doctors to conclude that they have to go back on it as well. I've seen a worrying number of clients with gastroesophageal reflux disease in the last couple of years who've been on a PPI for years, continuously for years, whereas the recommended duration of treatment for GORD is just 2 to 6 weeks. I've had really good success in weaning people who previously have suffered severe rebound acid hypersecretion when they tried to go off their PPI. And this includes children who are prescribed a PPI for infantile reflux using specific probiotics, nutritional supplements, and dietary and lifestyle modifications. If you're worried about taking a PPI and you'd like to explore other ways of treating your reflux, your gastritis, and other gut issues without raising your risk of dying, then go ahead and apply for a roadmap to optimal health consultation with me today. Just follow the link below the video. And I will catch up with you next week for another weekly update.